Okay, let's dive into something really critical for anyone around horses. Picture this. A brand new foal, just hours old, its whole world, really its survival depends on its mother. And then there's a problem. No milk, or, maybe not nearly enough. It's a situation every horse owner, every enthusiast just dreads.
Hmm.
And for good reason. We're talking about mare Agalactia and Hypogalactia today. What exactly are these conditions? Why are they such a huge deal for that little foal?
Yeah, you've nailed the absolute core of it. Agalactia means basically a complete failure. The mare's mammary gland just doesn't secrete colostrum, that essential first milk, or any milk at all after she foals.
Total failure. Okay.
Right. And then hypogalactia, sometimes called dysgalactia, that means she's producing some, but it's a subnormal amount, not enough.
Got it. Not enough.
And look, both are incredibly serious for the mare, sure, but especially for that foal, because getting enough colostrum and then enough milk is just non-negotiable for their immune system and getting nutrition right off the bat.
Absolutely vital. Non-negotiable. I like that.
Exactly. So our mission today, digging into the sources you sent over, is to really unpack why this happens. How do vets diagnose it? What are the essential treatments? And maybe most importantly, what can you, the listener, do to prevent it?
Okay. Laying it all out.
The goal is to give you a solid understanding, hitting the key points, the really critical insights, without, drowning you in information.
Perfect. So let's start at the beginning. Before we get into what goes wrong, what does right look like? How does a mare's body normally gear up and produce milk? What's the standard process?
It really is a finely tuned system, a biological symphony, as you said. So in late gestation, you have estrogens, things like equilin, equilinin, estradiol 17, and these come from the fetoplacental unit.
Okay, so the foal and placenta together.
Exactly. They work to get the mammary ducts developing. At the same time, there's a progestogen, 5-pregnan, that stimulates the growth of the actual milk-producing structures, the lobulo-alveolar bit.
Holding the factory, basically.
Pretty much. Then the actual trigger for lactation, for lactogenesis, is this really specific hormonal shift right at the end of pregnancy. Progestogen levels drop and prolactin levels rise just in those last few days.
The crucial timing.
Crucial. And prolactin, which comes from the pituitary gland, is absolutely central to making the milk the synthesis part. What's really interesting, though, is that prolactin release is normally inhibited by dopamine. That becomes important later.
Okay, inhibited by dopamine. Got it.
Then you've got oxytocin, different job. It's made in the hypothalamus, released from the posterior pituitary. Its role is milk letdown, ejection.
So opening the taps, not making the milk.
Precisely. It makes these specialized muscle cells, the myoepithelial cells around the glands, contract and squeeze milk out. Remember? Letdown, not secretion.
Okay. Prolactin makes it, oxytocin releases it.
You got it. And colostrum production, colostrogenesis, starts a few days before the mare actually foals. Full lactation usually peaks maybe 30 to 60 days after birth.
And it's a lot of milk, right?
Oh, yeah. We're talking maybe 2.5 to 4% of the mare's body weight per day. That puts huge nutritional demands on her.
Wow. Okay, so it is a complex dance. Every hormone, every process has to be right on cue. Given all that, what throws it off? What causes the music to stop or, just play really badly?
Right. We can sort of group the causes into two main buckets. You have primary issues, problems with actually making the milk, production failure.
The factory itself is broken.
Exactly. And then you have secondary issues. These are often more about milk letdown or other things getting in the way.
Okay, let's talk primary first.
Yeah.
And I know there's one cause that's, well, frankly, surprisingly common and a huge deal in certain areas. It involves grass, of all things. Fescue toxicosis. What's the story there?
Yes, fescue toxicosis. This is probably the most common and significant primary cause we see, especially in places like the central and southeast U.S., but also elsewhere.
What causes it?
It's caused by mares eating tall fescue grass, or hay made from it, that's infected with a particular fungus, an endophyte. It's called Epicloe conophiala. This little fungus produces compounds called ergot alkaloids. Ergovaline is a key one.
Ergot alkaloids. Okay, and what do they do?
Here's the critical link back to dopamine. These ergot alkaloids act as dopamine receptor agonists.
Agonists. So they act like dopamine.
Precisely. They mimic dopamine's action. And remember how dopamine inhibits prolactin release?
Right. You said that was important.
Well, here's why. The fungus, through these alkaloids, effectively slams the brakes on prolactin secretion. And since prolactin is essential for making milk,
The fungus shuts down milk production. Wow, that's sneaky.
it really is. It hijacks that natural hormonal pathway.
So what does that look like clinically? What signs would make you suspect fescue toxicosis?
Well, the most obvious is Agalactia no milk. But you often see other things too. Mares might have prolonged gestation, longer pregnancies, they can have difficult births, dystocia. You might see thickened or swollen placentas, which increases the risk for a red bag delivery, a premature placental separation. Retained placentas are also common.
And the foals.
The foals themselves can be weak or dismature, meaning they seem underdeveloped despite the gestation length, and often the mare shows very little udder development beforehand, or none at all, just flat.
When is the risk highest?
The danger zone is really if mares are grazing this infected fescue during the last 90 days of gestation. That's when it has the biggest impact on lactation prep.
And you mentioned it's not just a U.S. thing.
No, similar issues pop up elsewhere. Brazil sees it with black oat infected by Claviceps purpurea. Argentina has problems with ryegrass infected by Neotyphodium lolii. Different plants, different fungi, same nasty ergot alkaloid effect.
Okay, so fescue is clearly a major player, a huge piece of this puzzle.
Mm.
But what other primary issues, other production problems, can stop the milk flow?
Well, anything that leads to a premature birth can be a factor. Things like placentitis, inflammation of the placenta, or even twinning. If the foal comes too early, the mammary gland just hasn't had enough time or the right hormonal signals to fully gear up for lactation.
Makes sense. The process got cut short.
Exactly. And then there are other hormonal issues. We touched on dopamine.
Ah, yes. And you mentioned a specific medication connection that people really need to know about.
Yes, absolutely crucial. Pergolide. It's very common, very effective treatment for PPID, pituitary pars intermediate dysfunction, what many people call Cushing's disease in horses.
Right. Lots of older horses are on it.
They are. But pergolide is a dopamine agonist, just like those fescue alkaloids.
Oh, no. So it can also suppress prolactin.
It can. And that can lead to hypogalactia or full agalactia in a pregnant or lactating mare on the drug. This is really critical. If a mare is on pergolide, it must be stopped, under veterinary guidance, of course, at least 30 days before her due date.
30 days. Okay, that's a key takeaway for anyone with a breeding mare on pergolide.
Definitely. Less commonly, things like hypothyroidism might play a role, but that's not as frequent.
What about just nutrition? Or the mare herself?
Good points. Severe nutritional deficiencies, especially lack of energy or protein in late pregnancy and early lactation, can certainly compromise milk production. The mare needs fuel for that factory. And there's likely a genetic component too. Some mares, particularly maiden mares having their first foal, just seem to be lower producers or might be slower to start lactating. It varies.
And physical problems with the udder itself.
Yes, that can happen. Things like hypoplasia, where the udder tissue is underdeveloped, or even aplasia, where it's basically absent. Or if a mare had really severe mastitis or an injury in the past that damaged the tissue.
Okay, that covers a lot of reasons why milk might not be made. But you mentioned secondary issues too, where the milk is there,
But it doesn't come out. That's failure of milk letdown.
So how does that happen? The mare's udder would be full, right?
Exactly. That's the key difference visually. With failure of letdown, the udder is often engorged, tight, distended. With true agalactia, it's usually slack, empty feeling.
And why wouldn't she let it down?
It often comes down to stress, nervousness, or pain. Maybe she's a first-time mom and anxious. Maybe it was a difficult foaling and she's sore. Or sometimes there just isn't enough positive stimulation from the foal if the foal is weak or not nursing well. Remember, oxytocin release needs the right triggers.
And the mare might seem agitated.
Yes, she might even kick at the foal or seem reluctant to let it near the udder.
Okay. What other secondary causes?
Mastitis is a big one. That's a bacterial infection in the mammary gland.
Ouch. How would you spot that?
You typically see a red, hot, swollen, painful udder, or part of the udder, and the milk itself would look abnormal, maybe thick, discolored, even containing clots or pus.
Definitely sounds like an infection.
It is. And then just general pain or discomfort post-foaling. Maybe she has perineal tears from delivery, or she's colicky, or developing laminitis. Anything making her feel unwell can make her unwilling to stand still and let the foal nurse.
And you mentioned a weak foal not providing enough stimulus.
Right. If the foal isn't nursing vigorously, it might not trigger that oxytocin release effectively, even if the mare is willing. It's a feedback loop.
Wow. So many potential paths to the same worrying outcome.
Yeah.
Given all these possibilities, how does a vet actually figure out which one it is? What's the diagnostic deep dive look like when you, the owner, are standing there with a hungry foal?
It really has to be a systematic process. You can't just guess. It starts with a really detailed history. That's absolutely number one.
What kinds of questions?
We need to know, was there any possible fescue exposure, especially in late gestation? What's her drug history? Specifically, was she on pergolide? What about previous foalings? Did she lactate normally before? What were the details of this foaling? Any difficulty? Retained placenta? Red bag?
Okay, background is key.
Crucial. And how are the mare and foal behaving now? Then comes the physical exam of the mare. We look closely at the mammary gland. Size. Is it turgid, meaning tight and full, or is it slack and empty? We'll gently palpate it, feeling for heat, pain, swelling, any lumps or hardness, and we'll try to strip a little milk from each teat.
What are you looking for in the milk?
Quantity, obviously,
Yeah.
is there any? But also color and consistency. Is it normal-looking milk? Is it clearish, maybe like colostrum? Or is it thick, honey-like, brownish, watery, clotted? That tells us a lot. Plus, a general health check on the mare.
And the full exam.
Also critical, assess hydration, pinch the skin, check the body condition. Does the foal seem strong? Does it have a good suckle reflex? And, vitally important, we need to run a quantitative IgG test on the foal's blood, usually between 12 and 24 hours after birth.
To check for FPT, failure of passive transfer.
Exactly. Foals from mares with Agalactia or even significant hypogalactia are at extremely high risk of FPT because they didn't get enough antibody-rich colostrum. Knowing their IgG level tells us if they need more help, like plasma.
Makes sense. Are there lab tests beyond the foal's IgG?
Yes, depending on what we suspect. If we think it's fescue toxicosis, we can measure the mare's serum prolactin levels. They'll typically be low. You can also test the actual forage, the grass or hay, for ergot alkaloid levels to confirm exposure, though that takes time.
And for mastitis?
For suspected mastitis, a milk sample is key. We'd send that for culture and sensitivity testing to identify the bacteria causing the infection and figure out which antibiotics will work best.
Okay. And maybe general blood work on the mare?
Sometimes, yes. A CBC and chemistry panel can show signs of systemic inflammation or infection, or give clues about her overall nutritional status.
Right, putting all the pieces together. So once you have a diagnosis, or at least a strong suspicion,
Yeah.
what's the plan? And I imagine for the listener facing this, the clock is ticking, especially for that foal.
Absolutely. Urgency is the word. Immediate full support is always priority number one, no question.
So what does that look like?
If the mare is truly agalactic, especially right after birth, that foal needs colostrum now. Within those first 12 to 24 hours, ideally the first 6 to 12.
Where do you get it if the mare has none?
Good question. Hopefully the farm or vet has a frozen colostrum bank for mother mares. That's ideal. If not, commercial equine colostrum replacers or supplements are available. Even goat colostrum or milk can be used in a pinch, though equine-specific products have the right antibodies.
How do you get it into the foal? They might be weak.
Often we need to use a nasogastric tube, a tube passed through the nostril down into the stomach to ensure the foal gets enough. We aim for about 1 to 2 liters total in those first critical hours.
Okay, tube feeding. And then you check the IgG again.
Yes, we monitor the IgG at 12 to 24 hours. If it's still low, indicating FPT despite the colostrum, then an intravenous plasma transfusion is usually the next step to provide those vital antibodies directly.
And if the mare still doesn't produce milk after that initial period?
Then we're looking at longer-term nutrition for the foal. Commercial equine milk replacers are formulated for this. They need to be fed in small amounts very frequently, mimicking natural nursing.
Like every couple of hours?
Often, yes, especially at first. Or, the ideal solution, if possible, is finding a nurse mare.
Another mare who can adopt the foal.
Exactly. Sometimes we can even induce lactation in a non-pregnant mare using specific hormone protocols, turning her into a nurse mare. That can be a lifesaver.
Okay, full support is paramount. Got it. Now, what about treating the mare herself based on the cause? Let's start with fescue toxicosis.
Right. First things first. Get her off the toxic fescue. Immediately remove her from that pasture or stop feeding that hay. That's step one.
Remove the source. Makes sense. Then medication.
Yes. We need to counteract that dopamine effect, so we use dopamine antagonists, drugs that block the dopamine receptors, allowing prolactin levels to hopefully rise.
Okay, what are the options?
The main drug, really the drug of choice now, is domperidone. The common brand name is Equidone gel.
Domperidone, how does it work?
It's what's called a peripheral D2 dopamine receptor antagonist. Basically, it blocks those dopamine receptors, particularly outside the brain, letting the pituitary release prolactin.
And that helps kickstart milk production.
That's the goal. The usual dose is 1.1 milligrams per kilogram of body weight, given orally once a day. If you know a mare is high risk for fescue toxicosis, you might start it prophylactically 10 to 15 days before her due date. Or, if she foals and has no milk, you start it then.
How long do you treat?
Typically for about 5 days or until good lactation is established. Because it acts peripherally, it generally has fewer central nervous system side effects than older drugs.
Are there other drugs?
There are. Sulpiride is another dopamine D2 antagonist, often given by injection, but it seems less effective orally compared to domperidone. There was an older drug, perfenazine, but it's used much less now because it can cause significant side effects: sedation, wobbliness, agitation, sweating, even colic. So domperidone is generally preferred.
Okay. Domperidone for fescue. What about for the mare who has milk but won't let it down, the nervous or painful mare?
For failure of letdown, the key is oxytocin. That's the hormone for letdown.
Right. You give her a shot of it.
Yes, usually 10 to 20 international units, either intramuscularly or intravenously. It helps trigger that milk ejection reflex. But remember, oxytocin has a very short half-life, maybe only around 7 minutes or so.
So you might need to repeat it.
You might, especially around nursing times initially. We also need supportive care, maybe low doses of a tranquilizer like a cypromazine, but carefully to avoid making her too sleepy. Pain management is crucial if she's uncomfortable, and NSAIDs like flunixin or phenylbutazone.
And things like massage.
Yes, warm compresses on the udder, gentle massage, maybe gently stripping the teats by hand, can all help stimulate letdown and get things flowing. Create a calm environment.
Makes sense. And for mastitis.
Mastitis needs antibiotics, ideally based on that culture and sensitivity test we talked about, to target the specific bacteria. NSAIDs are important for the pain and inflammation. Hot packing the udder can help, and frequent stripping, milking out the infected quarter is critical to remove the infected material.
Okay. And if it was a nutritional issue?
Then it's about correcting the diet. Working with a vet or nutritionist to ensure her ration provides enough energy, protein, vitamins, and minerals to meet those high demands of lactation.
And finally, the pergolide-induced cases.
Well, the main thing is prevention, stopping it 30 days before foaling. If it happens post-foaling because maybe the timing was off, stopping the pergolide is step 1. Domperidone might be considered to try and boost prolactin, but honestly, the primary focus immediately shifts to ensuring that foal gets adequate nutrition through supplementation or a nurse mare. Mare treatment is secondary to foal survival there.
Understood. Foal first. Always. What about the prognosis? How well do these mares typically recover?
It really depends on the cause. For fescue toxicosis, if it's caught early and treated promptly with domperidone and removing the source, the prognosis for establishing lactation is generally pretty good. For failure of milk letdown, the prognosis is usually excellent once the underlying cause, pain, stress, is managed and oxytocin is used.
And mastitis.
Mastitis is more variable. It depends on the severity, the bacteria involved, and how quickly treatment starts. Sometimes it can damage the gland permanently.
Okay, so knowing all this, let's shift to prevention. Because ideally, you never want to be in this emergency situation. What does this mean for you, the listener, in terms of proactive management? How do you avoid these problems?
Prevention is absolutely key, especially for fescue toxicosis, which is so common. The single most effective strategy is simple, but not always easy. Remove pregnant mares from endophyte-infected fescue pastures or hay for the last 30 to 90 days of gestation.
Just get them off it completely. Feed something else.
Exactly. Alternative forage like orchard grass, timothy, alfalfa, or endophyte-free fescue. If complete removal isn't feasible, diluting the pasture helps. Overseeding with legumes like clover can reduce the amount of fescue the mare eats. Or the bigger job is pasture renovation, killing the old infected fescue and reseeding with endophyte-free varieties.
What about using domperidone preventatively?
Yes, that's an option in high-risk situations where mares have to be on potentially infected fescue. Vets can prescribe domperidone daily for the last 10 to 15 days of gestation as a prophylactic measure.
Okay, crucial for fescue management. What else?
Pergolide management is vital. As we stressed, discontinue it under veterinary advice at least 30 days pre-foaling. Ensuring optimal nutrition throughout pregnancy and lactation is fundamental. A balanced diet is non-negotiable.
Reducing stress.
Definitely helps. Providing a calm, quiet, secure environment, especially around foaling time, can minimize anxiety that might interfere with letdown. And just good general monitoring. Keep a close eye on mares as they approach their due dates. Watch for normal udder development, check for early signs of milk production, or lack thereof. Catching problems early makes a huge difference.
That is a fantastic, comprehensive look at a really vital topic. We've got from the intricate hormonal signals of normal lactation all the way to, well, the surprisingly powerful impact of a tiny fungus living in grass. It's quite incredible, isn't it? How that microscopic interaction can cascade into a life or death situation for a newborn foal.
It really is. And I think the key takeaways are the absolute need for prompt veterinary help if you suspect a problem, the critical importance of getting that foal supported immediately, and hopefully empowering owners and listeners with the knowledge to prevent these issues where possible.
Yeah.
If we step back and look at the bigger picture here, it really underscores these intricate, often invisible biological connections all around us. How something like a fungus on a blade of grass can profoundly change a large animal's ability to nurture its young. It makes you wonder, doesn't it? So maybe a thought for you, the listener, to ponder. What other seemingly small, hidden interactions, maybe in our own environment, could be having similarly profound, far-reaching impacts on health, maybe even our own health that we just haven't fully recognized yet?
Indeed. A fascinating question to think about, and that's a great thought to carry with you from this deep dive. Thank you so much for joining us.